All aboard for your chance to win $1,000 every week until December 28th. That's right, $1,000 cash just in time for the holidays. To hop on board, just head to ChurchillMortgage.com and punch your ticket to the Churchill Express giveaway. Visit ChurchillMortgage.com for your chance to win big.
This is a paid advertisement. NMLS ID 1591. NMLSConsumerAccess.org. Equal Housing Lender. 1749 Mallory Lane, Suite 100, Brentwood, Tennessee 37027.
Sometimes during Christmas, something magical happens.
Hey, Cricket customers. The Max with Ads plan is included with the Cricket $60 unlimited plan at no additional cost. And this holiday season, Max is the one to watch when you're feeling festive.
Son of a nutcracker!
Cozy up to all the holiday classics, like Elf, 8-Bit Christmas, and the Harry Potter 8-film collection. Just log in with your Cricket username and password to experience Max on all your favorite devices. Phone plan streams and standard definition. Programming subject to change. Fees, terms, and restrictions apply. See cricketwireless.com for details.
Hey, it's Jim Chapman reminding you that if you have not heard about Anchor, it's the easiest way to make a podcast. Let me explain. 1, it's free. 2, there's creation tools that allow you to record and edit your podcast right from your phone or computer. 3, Anchor will distribute your podcast for you so it can be heard on Spotify, Apple Podcast, and many more platforms. You can make money from your podcast with no minimum listenership. It's really everything you need to make a podcast in only one place. It makes it easy, folks. So do me a favor, download the free Anchor app or go to anchor.fm to get started.
Hi, this is Crystal Hardison from Southeastern Livingston Center. I'm the director, and you are listening to Local Leaders, the podcast.
Dr. Donald St. Angelo of Advanced Dental Care. How are you?
I'm good, Jim. Thank you.
It is your second time on Local Leaders, the podcast.
That's
so
right.
I'm assuming you had some fun the first time if you're back.
First go around was pretty good. That was a neat experience. Never done that before.
So you are a Denham Springs guy. Tell me where you were born and raised.
Yeah, so born in Baton Rouge.
Yep.
We lived out towards Livingston for a little while, and then in about the 7th grade, we moved out here to Denham.
Yep,
Been
figured
here
it
ever
out,
since.
huh?
Yeah, great place.
A great place, and you graduated from
Denham Springs High School.
Yep.
Class of 02.
Class of 02. You went into college, and eventually you ended up, obviously, in dentistry school.
That's right.
Have you always wanted to be a dentist ever since you were a young kid, or was there a time you wanted to be a weatherman like me?
Weatherman, that would have been a good one. No, kind of, about the time I had braces, I was in the dentist office a lot at that point. And that kind of really, just brought it to light for me. I was like, this is a really cool place to be. I'd love to work at a place like this. And then kind of, didn't think about it too much more until I got into high school, and it was kind of like, all right, fixing to go off to college, what we're doing here.
Yeah.
Kind of, figure some things out. And I was like, I'm going dentistry. That's what we're going to do.
It's interesting. A lot of people in business, they kind of figured out around that senior year of high school. Of course, there's people that go to college and they don't, they start off in one field and then they end up doing something completely different. But I find a lot of people that I sit down in here, they knew what they wanted to do by the time they were a senior in high school. You graduated from LSU School of Dentistry. Was that where you?
That's correct.
Okay.
Yeah.
Excellent.
It's in New Orleans.
In New Orleans, yeah.
Actually was driving from Denham Springs to New Orleans.
Really?
For a good bit of my schooling.
That's a trek.
I got a little dorm, I think my sophomore year, and I'd stay a few days a week over there. But, my wife was here. We were starting to do a little family and make our family, and her career and everything was here. So it was easier.
So you were married while you were
yeah.
Really?
We have our 13th year anniversary coming up next month.
Wow, I didn't realize that.
Do, yeah.
So you were able to get through all that, be married and start a family. And
oh yeah, she was like my sugar mama during school. She supported me and everything. Yeah,
excellent, way to go. Now you're paying her back.
She's still supporting me out there.
So very good. So you came back to Denham Springs and you opened up your business. I know you started out with a partner originally.
Yes. So actually, when I first graduated, I was at a different office for about 6 months, I think.
Okay.
And then we found out this office was coming up for sale pretty much. The 2 dentists that were in it before, they stayed on for a little while. One stayed on for about 4 or 5 months.
Okay.
And then Dr. Behringer, who was the original practice owner, he stayed on with me right up until the flood. And then after the flood,
he was like,
it was just me.
Here you go, Dr. Nah. You can deal with this mess.
That's it.
Yeah. That was around, how long was that practice? Well, it was after the flood that you took it over fully. Before that, it was you and Dr. Behringer in there?
That's right.
I got you. Okay. So in 2016, you took it over fully, and you've been rocking and rolling ever since. And I'll tell you one thing from a patient perspective, that when I walk in there, it is like, I've said this before other places, but it's like walking into something on Rodeo Drive in some ways. It's just very nice. The design of it, the layout. So when you did flood and you had to rebuild all that, you really, obviously somebody put some time into designing. And
definitely. Yeah. Now, the flood was a blessing and a curse at the same time. We were able to take that building that had been there. It used to be an old house back in like the 50s. And my wife came in and she just completely redesigned everything for us. And she had the goal in mind to make it as clean but as comfortable feeling as possible. Yeah. And she did great. It's beautiful.
The first thing you notice when you walk in is how comfortable it feels. It's just very, very nice atmosphere, especially for a dentist office, because you're already going in there. And a lot of people probably have a little anxiety. They're going to the dentist, and so it's nice to walk in somewhere and it's more relaxed and just it flows very well. So shout out to your wife.
Absolutely, because evidently there's a science behind that, colors and patterns and textures and all that kind of add to it. And yeah, she knew all that kind of stuff.
That's right. And colors will change your mood and everything else. Of course, I know a little bit about color, and it's interesting that a lot of your restaurants will have red walls.
Really?
Yeah, and the reason they have them, they're like dark red, is because red sparks your appetite.
Interesting.
So they want you to sit down and get hungry. So if you look around a bunch of red walls, you're like, man, I'm hungry. I don't know why I'm so hungry. So, yeah, there's a little tip for you I won't even charge you for. Man. So Jim's design tips for today. So anyway, beautiful office. Everything in there looks great. And I want to today kind of go over a lot of the things that you do in dentistry. Everybody knows you clean teeth. That's a one good thing that they do extremely well. But let's go into, let's say, the basic dentistry offerings that you offer. Cleanings and I guess braces would be part of that. Do you do braces?
We do some of the invisible braces, but like wires and brackets and stuff, we work with a good orthodontist, and we refer out to that office.
But you do invisible type.
Mm-hmm. Yeah, for many adults, they're pretty good candidates for it, just little minor movement and stuff, and the clear stuff works excellent for that.
Excellent. And tell me some of the other stuff you do as far as in your office.
Yeah, so, fillings, cleanings, that's kind of the basic stuff. We also do the periodontal cleanings, the deep cleanings and things. So
important.
If it's been a while, maybe since you've been in, you need a little more than just a touch up, we can take care of that.
Yeah.
Crown work, bridges, dental implants. That's the big thing now. A lot of people, instead of, maybe doing a lot of extensive work to try and save a tooth, it's kind of hopeless that you just try and hang on to. Now we can offer dental implants. And
and before you get off that point, I do want to mention, you make a great point, and that is sometimes you put a lot of work into saving a tooth that you as a dentist, you probably know. We can try to save this, but in all likelihood, it's not going to make it.
That's it.
And it may be even cheaper in the long run. Just put an implant in there.
Usually in the long run it is. And, everything we do, we base it off of predictability and science and, how long is it going to last, and statistically, how's this stuff going to look?
Yeah.
And we know with dental implants, they've just, instead of, like you said, trying to save that tooth, it might work, it might last 5 years, it might last 10 years. We know these guys are jam up for, 20 plus years. So, yeah, definitely in the long run, they pay for themselves.
Yeah.
They're really nice.
Yeah, no doubt about it. So you do the implants, and give me some other stuff.
So with implants, we even do some pretty extensive bone grafting, sinus lifts, things like that. So, a lot of people before, your general dentist didn't do that. You had to go to an oral surgeon. We can tackle some of the things like that. We still work with some excellent oral surgeons who come in and take care of some of the extreme cases for us. But some of the stuff we try and really keep it in the office. A lot of specialists don't take every insurance that's out there. We do accept a lot of insurances, so we really try and make it convenient for our patients and really, maximize their insurance and save them some trips from office to office and that kind of stuff.
Yeah.
So that really helps us out with that. But
absolutely. And one of the things I find interesting with folks that go to the dentist is some people have anxiety about it. Maybe they had a bad experience when they were a kid, or maybe they just are freaked out about somebody putting a drill in their mouth, those sorts of things. So you have some solutions for that at Advanced Dental Care.
Yeah,
tell me about that.
Dental anxiety is real. I mean, there are people who they get nervous walking into the office. So
really?
Yeah, just coming into the doors. Yeah. So we offer nitrous oxide, which is the laughing gas.
Yeah.
That's a nice little thing. Kind of feels like you had a cocktail. Just kind of eases your nerves, calms you down a bit. But we also do some heavier sedation stuff. We stick with the oral sedation.
Yeah.
We do not do the IV sedation in the office. We can send out to our oral surgeons and stuff for that. Yeah. But you take a few little pills. You come in. The world's a beautiful place. You're happy as can be. You come in. You usually take a little nap while we're doing the work for you. And you kind of come in. Life is good.
William Waldrop of TWFG Insurance in Denham Springs can service all of your insurance needs. Offering auto, life, health, and commercial insurance, William Waldrop of TWFG Insurance is a proud supporter of Local Leaders, the podcast. Yeah, it is. It's a real thing too, and it's good that y'all offer that.
Absolutely,
you probably can't just get that anywhere. I'm sure it's limited. And these, I have known several people that they're like, man, I really need to go to the dentist to get this or that done, but they're just totally. I mean, they really are freaked out.
Absolutely.
About it. And one of the good things we were talking about this earlier was your staff and how helpful they are in that process. You really got to have someone up front that can put people at ease and understands and gets that not everybody is a dentist or not fearful of the dentist.
That's right.
You have Keaton up there. I did want to mention him because he's bigger than life, with his personality, and he's really good at just kind of making people feel comfortable and at ease. Would you agree with that?
He is, absolutely. And I'll tell you one thing about it. He's got a memory like an elephant. He knows your name before you even walk in. He can see him walking up to the window in the front door. He's like, oh, so-and-so's here.
That's fantastic.
It's like, wow. And you walk in, he greets you with a big smile. He already knows everything about you pretty much. He really takes a lot of in-depth care for his patients and, knowing everything he needs to know about them.
Yeah, and he takes pride in his job, and it shows, and what a nice guy. And I'll tell you, knowing some people's names and things like that when they come in makes all the difference in the world sometimes.
Absolutely.
They feel welcome. They feel part of the Advanced, dental care family and all those sorts of things. So,
and Jim, the entire staff is like that. They know, talking about the anxiety, they know sometimes it's super hard, like I said, just to walk in the door. So anything and everything we can do to make them feel good and comfortable when they come in, we try and do that 1,000%.
Fantastic. Yeah, it's so important. And you do a great job of it. My whole family goes, and y'all do such great work over there. Now I want to get into, you have the name Advanced, that's in the name, and you're very advanced, and you have a lot of interesting equipment over there, machines. And so first I want to get on that dental side of things and the offerings that you do. And my terminology is horrible, but I'll say 3D x-rays or whatever. Kind of take me through all of the things you can do as far as your x-ray equipment.
Sure. So we have everything's digital. Some of the forms we fill out are on paper, but then they all get transferred into a digital format. But all of our x-rays are digital as well. We don't have to wait for the film to develop anymore. We take an x-ray, it pops up instantly. Along with our x-rays, we have some 3D capability. So we have a cone beam CT machine, which is a 3D x-ray of, basically from your shoulders up.
Yeah.
And with that, we can, that plays a huge role in our oral surgery stuff. Our root canals and things like that we can do. Many times they have hidden canals and things, and we can see them on these 3D machines.
Actually around?
Yeah. It rotates around your head. It's not like laying in an MRI where you're laying in there for an extended amount of time. It takes a few seconds.
Wow.
Spins around, you get a 3D version. We can zoom in and out. turn it any way. We can see bone density, all kinds of great things we can tell from that. Airways, people with sleep apnea and things like that.
Oh, that's huge. Yeah. And I'm glad you mentioned that. That is something that you can kind of see people for and,
that's right.
and help them through, right?
That's right. Yeah.
Yeah. That's a good thing to mention, because a lot of people don't realize sleep apnea may have something to do with a lot of people assume it has something to do with the way that you sleep, or maybe you're doing something wrong, but aren't there mouthpieces and stuff like that you can get for sleep apnea, or some sort of offering?
You sure can. Yeah. If you're a mild case, you can, you may not have to have a CPAP machine or, something with positive pressure air in it. You can sometimes just have an oral device that just kind of holds your jaw into a certain position and allows that airway to stay open.
Got you.
And yeah, for some candidates, that's a easy method to use.
Yeah. And grinding teeth is a problem.
Yes, and that has a huge.
I must dream and like get mad in my dreams. I don't know what it is, but let's talk about that a little.
Yeah, because there's a huge link between grinding your teeth and sleep apnea. Yeah. So some of the things we see are people grinding their teeth, some acid reflux, and then all that it kind of keeps you tired throughout the day. You can feel very sluggish. That'll have an overall effect on your health. It's a huge issue that we really try and get our patients aware of when we discover it.
And when you do you have like mouthpieces and things that you offer for teeth grinding? Or
we do, yes.
Okay.
Yeah. There's different levels of that. The two main ones, we have a thinner one. Mm-hmm. We refer to it as like a day guard.
Yeah.
It's comfortable enough. You can wear it during the day. You can talk with it. It doesn't really put your jaw into a particular position to open your airway or anything.
Yeah.
It just kind of protects your teeth.
Interesting.
Yeah, but then we have the thicker ones, and a lot of people are familiar with those. Those are referred to usually as night guards and things like that. And they will hold your jaw in a more neutral position and kind of help with the clenching and grinding and stuff.
Yeah, a lot of people that they probably need that mouthpiece for clenching, but their apprehension is, I won't be able to sleep. What's your thought process? What do you tell people when they say that?
So our mouths are very sensitive. We can detect a hair between our teeth. So yeah, you stick essentially a chunk of plastic in between your teeth. You're going to know it's there.
No doubt.
Usually it's very easy to get used to, but we do have some patients that are highly attuned and they don't wear them very well. We offer Botox for those kinds of patients.
Interesting.
What it does, just like relaxing the muscles, for wrinkles and things like that, we relax the jaw muscles. So that extracurricular activity of clenching and grinding and things like that, you don't do it. Okay. And it works 24/7, not just when you're wearing your guard at night. It's working during the day. It's working while you're asleep.
Wow. Yeah. That's interesting. So there's a lot of options, to help your concerns, whether it's with your clenching and you're worried about, I'm not going to be able to sleep with a mouthpiece, or you're just nervous about going into the dentist. It seems like y'all have some solutions to all those kind of issues.
We try. We definitely try.
Yeah. Very good. Now, so let's get back to your equipment. We talked about the 360-degree X-ray equipment that you have, and the fact that one thing to note is you don't have to wait for those X-rays to come back. They come back, I would imagine it's almost instantaneous. You can pull it up on the screen.
That's right. Our 2-dimensional ones, they're instant. As soon as you push the button, boom, it's on the screen. The 3-dimensional takes about 10 minutes to develop.
Yeah.
Or process.
Yeah. Not bad at all.
No, not at all. Usually by the time they bring the patient back to the chair, I'll come in, I'll take a look at things and start looking, and it's ready for me at that point.
Yeah. And I think about dentists way back in the day before all this was, really something that was even an option. And wow, how did they do it? X-ray equipment is a great example of that. Everything's just instantaneous, so it saves time.
It does.
And that's our most valuable asset. We don't get that back.
Absolutely. Right? People are so busy these days. Yeah. It's hard to get into, your doctor's appointments, any appointment.
Or get someone to even make an appointment like me. And, that's what Keaton's for. He keeps me on task on that.
He's going to call you. He's going to text you. He'll email you.
Yeah. I need it. So tell me about some of the other equipment you have over there, because y'all are very advanced.
So I'll tell you, our newest thing is, and this technology has been around for several years, but it's intraoral scanning, which is, we're really excited. We just got a new one. It's been about 4 or 5 months ago.
Yeah.
But instead of taking those goopy impressions to get the molds of your teeth, and you got to send it off to your lab and make all your devices and all that, we've got where we can do all that in office. We can do the intraoral scanning right then and there. It's a 3D version. You don't have to go through the goop anymore. So unfortunately, some people gag a lot when you take some impressions and things. We can eliminate that option for them. So
wow, that's
really
great.
nice. Yeah.
Yeah, and it's right there in office. You don't have to go somewhere else and come back and it become a kind of a tedious thing, because people do look at that, and when you have to send them somewhere else, you do that, and then they're going to send me your chart, and you come back over here, it becomes now I've got to schedule my whole life all over again. You can do all that in house.
That's it. We just try and make it as convenient as we can, because it's hard. We know that.
Yeah, it is. Everybody's living a crazy life. So getting back to your equipment, you can do all that on your dentist side, and I do want to talk about your is it a health spa?
Med spa.
Let's talk about your med spa stuff.
Yeah, so that's the fun stuff too.
This is the stuff that's going to get 5,000 views right here.
We love making people pretty. Yeah. So, we've always done Botox and Juvederm, the fillers and the relaxants and stuff. And then we've, over the past several years, we've gotten into more of the higher end cosmetic stuff.
If you're in the market to purchase a home or sell your home, then Tricia Johnston of Ladder and Bloom Realty can assist. With over a decade of experience in the area, Tricia's vast knowledge of real estate makes her the perfect realtor to represent you. For more information, Tricia can be reached at area code 225-754-2000 or via her website at triciajohnston.com. Tricia Johnston, building a strong foundation of trust, one home at a time.
So we've got a whole slew of fun tools. Let's see, we could start with our biggest thing is profound radio frequency microneedling.
Yeah. Tell me about that.
So we are one of, I believe, 4 machines in the entire state.
Wow.
Yeah, and this technology, it basically is a skin tightening, skin rejuvenating system. It's one of these one and done. Many of your cosmetic things, you come in and 3 weeks later you come in for a second treatment. 3 weeks later you'll come in for a third. This one's one and done. It's good for about 5 years. You can do some touch ups in between if you need to, but it is a non-surgical facelift essentially, and it's about 1/3 as effective as a surgical facelift.
No kidding.
So it's incredible. It's some of the top technology out right now.
Yeah, because some people, the hesitation is the surgery on maybe a facelift.
Sure, downtime, all that kind of stuff. There's no real physical downtime with this. You have a little bruising right after, a little swelling. We refer to it more as social downtime.
Yeah.
But with mask and everything, social distancing these days.
Good point.
Oh my gosh, it's perfect for right now.
Yeah. So do it now. Don't wait.
Now. That's right.
So very good.
Yeah, we've got the Profound machine. Then one of our other machines is body contouring. Yeah. So we have some that's fat eliminating.
Excellent.
And then we have some that's temporary fat reducing. It's a little quicker treatment, a little easier treatment.
Yeah.
After we get through the body contouring, we also have some sublative skin resurfacing.
Yeah.
Which a lot of people are familiar with that. That's a really, really hot topic right now.
Okay.
Super, super easy, minimal downtime.
So what does it do? When you say resurfacing?
Yeah. So it uses that same radio frequency technology we were talking about a second ago, and it essentially just causes cellular damage, but in a way where your body recognizes that, and then it says, okay, I need to heal.
Okay.
So it does a minimal amount of damage, then your body comes in and heals, and as it heals, it's like a fresh start.
Wow.
That's a lot of the facial cosmetics and things, that's the essence of how they work. Controlled damage, and your body comes in and takes over and heals up and gives you a new set of skin almost.
Wow, that's really cool.
Yeah.
Now, would that work on, like, I'll give you a hypothetical, sunspots? You know, some people get sunspots and they want to make those go away.
So the sublative isn't the main treatment for sunspots, but we have IPL, which is intense pulse light. That's the photofacials you've heard people talk about. And so pigmentation issues, if you have uneven skin colors, dark spots, red spots, things like that, the IPL photofacials will really take care of that.
Really?
Yeah, little freckles, sunspots, all that kind of stuff, zaps them right away.
No kidding.
Yep. Very cool.
Y'all hear that? This ain't no joke. Go make an appointment with Keaton.
That's right.
That's fantastic stuff. So let's back up a little bit and talk about the you have mentioned skin tightening. So when you talk about that, we have, of course, I get wrinkles. I don't know what you call the 11s. I think
the 11s. That's it.
So that machine would actually help make that kind of go away. Or is that more of a Botox issue?
Well, it's kind of combined. So your Botox is going to relax the muscle, which is what moves the skin to cause the wrinkle.
Yeah.
Sometimes these wrinkles have been there for so long, they're almost like scars. You know what I mean? So even if you relax the muscle causing it, that dent, that wrinkle is still in the skin.
Yeah.
So we can come back on top with the sublative, and that will help to resurface the skin, kind of reset it back.
Yeah.
But we also have some other skin tightening things. The Sublime is on that same unit as the Sublative, and Sublime is the red carpet facelift.
Yeah.
It's a great thing. You have a party coming up, Saturday night, you come in and you see me on Thursday or Friday.
Yeah.
We tighten you up and you're ready to go for your party Saturday. No downtime whatsoever on that. Painless, beautiful procedure. Yeah.
That's fantastic. And about how long does it take? Kind of, and I know it varies depending on what you're doing, but what is it, like an hour process usually? A couple hours?
20 minutes maybe.
20 minutes.
Yeah.
Wow, man. That's a lunch break.
It's quick. Yeah, very quick.
Fantastic. I do want to talk about the fat disappearing machine, or for lack of a better term, because that's one that everybody's ears popped up when you mentioned it. Tell me about that. You said there's two. There's one that kind of well, let's talk about them again.
Yeah, so there's two main ones. We have VelaShape, which shrinks the fat cells and tightens skin at the same time.
Okay.
You can do really larger areas with that.
Yeah.
It's very quick. You do a few treatments, very effective. We also have UltraShape, which destroys the fat cells. So a lot of people have heard
destroy.
Oh yeah, a lot of people have heard like cool sculpting and things like that. It's a similar technology to that, but instead of freezing the fat cells to destroy them, it uses ultrasound technology. So you don't feel anything. You don't have that cold.
Wait, there's no pain.
You feel like a little vibration as it's doing it. Kind of feels good.
Yeah.
And that's
like
it.
a massage.
Yeah.
Wow. It's unbelievable, because you would think it would be extremely painful and all these sorts of things.
No, not at all. No, it kind of feels good.
Wow.
Yeah,
awesome.
Brings a little heat to the area and everything. Yeah, it's kind of nice.
So how long does a process like that take? Usually about 30 minutes, an hour?
That one's more dependent on the size of the area.
Yeah.
The VelaShape, usually we do it in certain quadrants, I guess you could say. And they take about 15, 20 minutes per area.
Yeah.
So depending on how many areas you want to do. UltraShape's pretty similar. It's a little bit longer. It's maybe a 30, 45 minute procedure.
Okay.
You just kind of lay there the whole time, answer emails, play on your phone, Facebook, Twitter, whatever. Yeah. I mean, I don't need you to do anything for me. We take care of all the work.
When you do the laser hair removal, how long how long is that process before it grows back, or does it ever?
So it's kind of different on everybody, depending on hormones and, what type of hair you have and all that kind of stuff. But you can, I guess you could say on average, it's about a year or so.
Oh, wow.
Yeah.
I never thought it'd be that long.
Yeah.
So it ain't every 3 days for sure.
Not every 3 days. No.
Fantastic.
And it's pretty quick too. An armpit, we can do one armpit. Oh my gosh. We've never timed it. Maybe like 3 minutes, 4 minutes. Yeah.
Wow.
It's not too bad.
Wow. So, and that's something, I'm glad you mentioned that. So laser hair removal, they do it right there at Advanced Dental Care, and they can get you fixed up and in and out of there in a jiffy, and you ain't got to worry about it for a long, long time anyway.
That's it.
Fantastic. So you do teeth whitening and all that stuff too?
We do, yeah. We've got several teeth whitening options. You could do in office. So if you got an event coming up soon, you need kind of that instant tooth whitening.
Yeah.
We can do it in office. Takes about an hour and 20 minutes.
Yeah.
Yep. We also have some take-home versions. We have more of a stock tray take-home thing that you can use.
Right.
Super convenient. Pop it in your mouth when you're driving to work. Take it out when you get to work. We also have some custom trays that you can use at night where you just buy the gel refills.
Yeah.
The whitening gel refills. And, if you want to do some long-term bleaching, that's a great option as well.
Yeah. So what else are we doing? I know one thing with Advanced Dental Care is y'all are very giving to the community, and you do something really special once a year, and I want to talk about that. I'm not sure what time. It's probably not this time of year that you do it, but I want to let people know that it is offered, and that's your deal you do with the military.
Yeah, it's called Freedom Day. It's usually around September, October every year. And we didn't get to do it last year with COVID and stuff going on, but we're going to jump back in on that. And it's usually around September. And it's a day of free dentistry for anyone in the military, either whether active or retired, and their immediate family.
That's fantastic.
Yeah, it's great. So we get them in because, unfortunately our military guys, they aren't taken care of as well as we think they should be. So
sure.
we give it's a day. It's nothing for us, it's easy. And it makes a huge impact on a lot of people.
Yeah. Well, we appreciate it, and you giving back, and that is something that's unique to our parish in a lot of ways. Is a lot of our businesses give back, and you're certainly no exception. And that would be probably, of all the charities that I'm familiar with, that's one of my favorites. Is the military charities, really, of any sort, but especially what y'all do, because you bring up a good point. And our ex-military guys are, especially they have issues getting proper dental care sometimes.
Yeah.
And so to offer that to them, it speaks a lot to all of you at Advanced Dental Care. We appreciate that, of course. They'll have some interesting things going on right now. They don't even have to get out their car for their appointment. They just call and you come out and get them at their time, or how does that work?
That's exactly right. Yeah. So when you arrive, you give us a call, you let us know that you're here. And when your room is available, as soon as it's ready, we come out, we get you, we walk you in straight to your room. The room's been completely disinfected, sterilized. Everything is, super clean. You've seen it.
Yes.
That's a
just
huge
like it was before COVID, incidentally.
Just like it was. That's right.
Yeah.
And PPE wise, we've taken some extra precautions, but no, we're cleaning things. We've always cleaned things.
Oh, yeah.
Super clean.
Yeah. I mean, you were treating it like there was COVID before there was COVID. There's no doubt about it, especially your dentist office.
That's right.
It's always top notch.
And our office is not a big open platform. Mm-hmm. Kind of, if you've seen before, some guys will have chair. You've got your own private room when you're there. So, everything's kind of walled off. So it's nice.
Yeah. You have, what is it? Five rooms there.
We have six.
Six okay.
operatories. Yes, sir.
Wow. Yeah. So, they're right there on range, folks. And when you pass it, you wouldn't believe. It's hard to describe, so you're going to have to go there, make an appointment, and get something done to see what I'm talking about. It's hard to describe, but when you walk in there, it is like from the outside, and it doesn't look near as big as it does when you walk in. When you walk in, this is a big building on the inside.
Yeah, it is pretty good size.
Yeah, it really is, and it's been around a long time. As you said, since the 50s. It used to be a house way back in the day. And conveniently located right there on Range Avenue. I'm trying to think of a landmark that you could say it's across the street from.
Across from the Gaddy's Pizza and that shopping center right there next to Po' Boy Express.
Yeah.
Right there. I'll tell you a fun little fact. The staff was telling me this the other day. They said that Dr. Behringer several years ago had gotten some sort of award or recognition for that being the longest running commercial business on Range Avenue.
No kidding.
Isn't that neat?
Well, that's a fun fact I didn't know. Yeah.
I learned it myself recently.
Interesting. There you go. So not only are you going there and getting good dentistry work, you're becoming a part of history. All the folks over there, they make you feel at home when you walk in. You want to talk about someone with good bedside manner, I guess you could call it. It's hard to beat Dr. Don. There's no doubt about it. He makes everybody feel calm. That the businesses that really dug deep and made changes where they had to after COVID, or maybe, they said, we're going to keep moving. We're going to keep doing dentistry work. And so we're going to make everybody feel comfortable, and let's come up with a plan. And those are the people that really, had the benefit of still maintaining their patient count or customer count, or you name it.
I tell you, it's been different. We've had a lot of, unique things going on that we had to go around with, spacing out patients and, cleaning the rooms and the turnover and, having patients waiting in their cars and all that kind of stuff. Things that I think honestly have kind of turned into a good thing.
Yeah. Yeah. Well, I saw an interesting stat on the news the other day, and it was the flu. And they said, it's almost non-existent right now, because, at one point they were talking about the flu and COVID being there at the same time and being like a super COVID.
Right.
Well, I was like, I don't want a super COVID for sure, but no flu, hardly any flu cases. So that's interesting.
That's great.
And
I think people are more aware. They're washing their hands more. They're conscious of what they're touching and putting their hands in their mouths and in their eyes and all that. So I think it's really kind of enlightened a lot of people on proper hand hygiene. And
it really has. And that's a good way. We try to put a positive spin on everything. And one thing I will say, even me personally, I will wash my hand. I was always a good hand washer, but it was like 3 seconds, it was soap, I'm too ADD to sit there too long. And, I'll tell you what, since COVID hit, I do kind of do that 20-second deal.
You sing the birthday song now?
Yeah. gotta go 1, 2, 3, 4. Yeah, somebody told me about the birthday song.
We got Alexas in our house, and you know, the kids even rely on these things. They're like, hey, Alexa, set a 2-minute timer while I brush my teeth.
Yes.
Yeah. Hey, anything that makes things easy for us.
I love it. So you bring up a good point there. It has helped people with hygiene and and hopefully once you get in a habit, it's hard to kind of break that habit.
That's
so
right.
It's a good habit to have.
Good habit to have.
So you're a hunter as well. You like to hunt a little bit?
I do like to.
How was hunting season this year?
Hunting season was a little slow.
Yeah.
So my hunting seasons are a little different these days. The boys come with me now.
Oh.
So I'm more of the guide than the hunter. So, but man, I tell you, it just brings a totally different aspect to hunting. It's a lot of fun. They did good. They got some good deer this year.
Really?
Yeah.
Awesome. I appreciate having you on today. Is there anything else you wanted to mention that maybe we haven't got to?
I think we covered a pretty good bit.
Yeah, and what I'm going to do with this, so I want to tell all the listeners out there, everything we talked about today, I'm going to link in the description of this video, including Dr. Don's website. Give us a shout out on your website real quick.
Yeah, it's going to be advanceddentalcarela.com.
Yeah, there you go. So go check that out, and I'm sure he has some information on there all about a lot of the stuff we talked about, but I'm going to link some other things in there that and maybe even pull some pictures off his Facebook and stuff like that, of the things we're talking about.
Yeah, if they go on and check that out, they can even request an appointment from the website.
Yeah,
make things a little easier.
There you go. That's good to mention.
Or just when you call, you're gonna either talk to Heather or Keaton. So when you call and you hear Keaton or Heather's voice, you know exactly who it is.
You just don't have that 5 minutes to make a phone call. You can do it right there on the website.
Right.
That's good to mention. So we appreciate you coming on again.
Thank you.
Hope you enjoyed it. New office, new podcast room, and
fantastic
and
new
all
room.
That stuff. So we're very, very proud to feature local businesses like yours. And always, anytime you want to come on, you're welcome. I'd like to have you on again when it gets close to doing the military stuff that you do. That'd be a great thing to
give everybody a little reminder before we do that. That'd be perfect.
Absolutely, absolutely. I do want to thank the lady off camera. It is Casey McMurray. She's off camera. She does so much to help Local Leaders, the podcast, as our executive producer. Until next time, I am Jim Chapman, reminding you to love your community, support local business, and keep leading. Thank you. Stephanie Berthelot and the crew at SR Enterprise can handle it all, from sheetrock to texture to paint. Give Stephanie a call at 504-432-9284. SR Enterprise, where they spread the paint and you spread the word.
All aboard for your chance to win $1,000 every week until December 28th. That's right, $1,000 cash just in time for the holidays. To hop on board, just head to ChurchillMortgage.com and punch your ticket to the Churchill Express giveaway. Visit ChurchillMortgage.com for your chance to win big.
This is a paid advertisement. NMLS ID 1591. NMLSConsumerAccess.org. Equal housing lender. 1749 Mallory Lane, Suite 100, Brentwood, Tennessee 37027.
Sometimes during Christmas, something magical happens.
Hey, Cricket customers. The Max with Ads plan is included with the Cricket $60 unlimited plan at no additional cost. And this holiday season, Max is the one to watch when you're feeling festive.
Son of a nutcracker!
Cozy up to all the holiday classics like Elf, 8-Bit Christmas, and the Harry Potter 8 film collection. Just log in with your Cricket username and password to experience Max on all your favorite devices. Phone plan streams and standard definition programming subject to change. Fees, terms, and restrictions apply. See cricketwireless.com for details.